Right. Well, a happy new year, everybody. I hope everyone survived the holidays unscathed. My name is Shannon McBee. I'm the state epidemiologist, and this is the Kanawha County um, HIV Outbreak Task Force. Welcome, everybody. Um, we've got the agenda posted in the chat for everybody to view. We're going to start out this afternoon's meeting with some opening remarks from Deputy Commissioner Amy Atkins.
Hi, good afternoon, folks. Good to see you and Happy New Year as well. I did just want to open the meeting with a couple of remarks and follow up to last month's meeting discussion and questions regarding the role of the state in advocating for syringe services and really focusing and reinforcing the purpose of this task force meeting with some basic guidelines and parameters moving forward. First, I just want to share that the Bureau for Public Health is committed to supporting and providing transparency to the public regarding the response activities and the current status of the HIV outbreak. And we're very appreciative and supportive of the collaboration of all the community partners that are involved in this response effort. This forum was created by Kanawha Charleston Health Department and is supported by the Bureau as a means of providing pertinent information and updates regarding the community's response to the HIV outbreak in Kanawha County. And the forum is not an appropriate forum for setting or influencing state and/or local laws. It's really designed to share information about ongoing response activities and the current status of the outbreak. The interventions and activities that are being designed and implemented to support the response are being done so and will continue to be designed in accordance with state and local laws and ordinances. And we know there are many partners working hard across the state, across all pillars of the response to help do just that. And we appreciate the commitment and dedication of everyone that is working to identify innovative and creative approaches to addressing these extremely complex response activities within the context of our laws. So to support alignment with these guidelines, we may table questions that are not germane to the purpose and are happy to follow up with written responses. That will make sure that we really are focused on providing the update that is intended for this meeting, which is an update that Shannon will provide regarding the epidemiology of the outbreak, as well as the very important updates of the activities occurring in the community by all of our response partners. So we're continuing to offer these meetings monthly in an open and transparent manner and ask that you assist by respecting the parameters and purpose of the forum. And we really appreciate everyone joining us today and look forward to the next hour to hear those updates from our partners. So I'll turn it back over to you, Shannon. Thank you.
Thank you so much, Amy. And moving on with the agenda, we'll start off with our EPI update. Just bear with me as I attempt to share my screen. And before I start, if someone could make sure that you can see my slides.
Yes,
You're good.
I can.
Thank you. Let's see if I can hide you guys. There we go. All right. So the current outbreak data that you see in front of you reflects an increase of 3 new HIV diagnoses since the last time we met in December. And all 3 of the cases were diagnosed in the 4th quarter of 2021. Currently, 40 of the 52 cases that have been diagnosed so far in 2021 in Kanawha County have been confirmed to be associated with injection drug use. And just a reminder, this data does represent residents of Kanawha County who were homeless in Kanawha County at the time of their HIV diagnosis. And we did mention this last month, but just some things to keep in mind when looking at this data in terms of the case counts and HIV outbreaks in general. There are several factors that contribute to the fluctuation in case numbers. This includes reporting delays, It does take time to locate individuals and interview individuals and identify those risk factors that are associated with those individuals. And although we have seen decreases over the last 2 quarters, in terms of the new cases identified, we also need to take into consideration other factors that may be contributing to this decrease. And this includes some of the weather that we've experienced, as well as COVID surges. It's really too soon to draw any type of conclusion at this time. We also know as cold weather sets in, clients are not about, and it really becomes difficult to locate these clients, to interview them, and find them for services and testing. So looking at the epidemiology of the outbreak, really the epidemiology remains unchanged. There are slightly more male cases than female. 81% of the cases are between the ages of 20 and 40 years of age, and 50% report being homeless or unstably housed in the past 12 months. 89% are co-infected with hepatitis C, and a majority of the individuals are being diagnosed in the hospital setting at 45%. One point that we did want to clarify, as you hear from partner updates this afternoon, you will hear them talk about numbers that may or may not match the numbers that we're presenting on these slides. Remember that there's a specific definition that is used to count cases, and we only include cases that are diagnosed for the first time in Kanawha County since 2019. For instance, a positive client at the Ryan White Clinic who's working to get on treatment may have been previously diagnosed with HIV in another state or a county, and per standardized national reporting practices would mean they are not counted as a new diagnosis in Kanawha County, just as an example. Next, looking at medical status of the Kanawha County outbreak cases, most of the categories continue moving in a positive direction. There was a slight increase in the number of individuals who are currently engaged in care and the number who were virally suppressed at their last test. Just a reminder, you can find statewide data by county on our state website. There's also a specific tab specific for the Kanawha County HIV outbreak, and this is hivawarewv.org. And then Suzanne mentioned last month during her regular update that training has been made available as part of our response activities. The Bureau has partnered with the Regional AIDS Education and Training Center to develop virtual training sessions covering compassion fatigue, basics of HIV, stigma, HIV testing and PrEP, and care of a person with HIV. These sessions will be repeated at multiple times to provide more opportunities for attendance. And there are specific tracks with material tailored for each group, and information is available on our website under the upcoming training section by going to the address listed on the slides here. And that concludes my update for this afternoon. Right, and I think I saw Jolynn on. There she is. Hey, Jolynn, Happy New Year.
Happy New Year to you guys too. And thank you guys for inviting me to this meeting. I am the director of the Office of Health Facility Licensure and Certification, commonly referred to as OFLAC. We are the department within DHHR that has been assigned the regulation, the licensing of syringe service programs. We have to date 12 programs that are licensed as syringe services programs. They had to meet the criteria established in law, which was offering the full array of harm reduction services. And then they made application to OFLAC. Their policies and procedures were reviewed, and these entities were offered or then earned a license. The way the law works is if complaints are received on these entities, then they will be evaluated. And if they are against the regulations, then OFLAC would investigate any complaints. I received this question quite a bit of, well, where are the programs at? How can I get a list of them and so forth? This information is available on our website. So if you go to OFLAC, ohflac.wvdhhr.org, there's a tab at the top that says health facility search, healthcare facility search. If you click on that tab, the bottom one says health facility search. You click that, and then in a drop-down box, you can select syringe service program and hit submit. And it'll bring up all the programs that are licensed in West Virginia. If you're looking for a program in your area, you can, set the criteria tighter and just find ones in your area or such. And this is true for all the healthcare facility types that OFLAC regulates. All of that online. If there is a survey, on-site survey that's completed, like a complaint or such, once that complaint is completely closed out and all due processes have been given, then the results of any complaint would be online. But an important thing to remember with not only syringe services programs, but with all OFLAC programs, we do not and cannot post the survey results online until everyone has had an opportunity all parties have had an opportunity to due process. The timeframes have elapsed for any of those requests. And if they have invoked those due process rights, then that has to take place. So sometimes that can be, that can take some time. So I just wanted to make sure that everyone knew that information was on our website. I also wanted to introduce Kelly Cooper. Kelly Cooper is on the call here. Kelly is the program manager that is directly over syringe services programs. She has worked very close with all programs because it is something new. So she and her team have done an incredible job meeting some very tight deadlines because the law required that these programs that were existing must apply and be licensed, must apply by January 1st, 2022. So when we were receiving last minute applications at Christmas, her and her team really just jumped up and really helped. So Kelly and I will be on the call in case there are any questions. I do have to jump off at 1, but thank you guys again for inviting me. Kelly, if you have any words to give the group.
I just agree with what you said, Jolynn. We worked as hard as we could throughout the end of the year to get all 12 of those programs licensed, and feel pretty good about what we accomplished. We haven't gotten any new applications, so.
Very good. Thank you, Kelly. And I'll turn it back over to you, Shannon.
Great. Thank you so much for the update. We'll pivot over to Suzanne for any program updates.
Sure. Thanks, Shannon. Good afternoon. So the Division of STD, HIV, hepatitis, and tuberculosis continues our outbreak response activities. We're currently working to schedule testing, create the calendar for testing outreach all across the state. for 2022. And our testing folks have been working with Kanawha Charleston Health Department and other partners to hold and schedule indoor testing events during the winter months in a as COVID safe way as possible, and utilizing venues such as warming centers and things like places like that that get opened up to try to reach the target population kind of throughout the winter when it's a little more difficult to find those individuals. We are also offering on a monthly basis we're increasing access to training as one of our response activities, and so we are offering on a monthly basis the counseling and testing course that is required for folks to be trained to do HIV testing. So that's being offered virtually on a monthly basis now. And we're also working to continue facilitation of discussions on projects to increase testing in the emergency departments and correctional facilities with our partners in those realms. And that's all I have for today. Thanks.
Thanks, Suzanne. And I don't see Dr. Young, but Robbie Queen. Hi.
Hey, it's
How are
Robbie.
you?
Good. How are you?
Good. How are you doing?
Well, we're surviving here today, I think.
Understand.
Dr. Young did ask me to be on the call. She's actually making a presentation to the West Virginia Immunization Network at this same hour, so she wasn't available to be on. So I'll be taking notes back to her. But we did have a testing event right before the holidays in London, West Virginia, not London, England, in which we partnered with several community partners to make that one happen. And as Suzanne alluded to, as we are able to safely with the current COVID situation, we will be doing future indoor testing events. But right now we are experiencing staff shortages, as everyone is, and are experiencing some pretty high COVID numbers. Well, not pretty high, record high COVID numbers here in Kanawha County. That has kind of shifted us back to that. We will be looking to do future indoor testing when it's safe during the winter months, and then absolutely back out outdoors as the weather permits. Hopefully in the next couple of months, fingers crossed. Thank you.
Thanks so much for that update. Yes, can feel the Omicron pain for that. Angie, do you have an update from HealthRight?
Yes, I do. We feel Robbie's pain as well. We did a record number of COVID tests. It was last week or the week before, 827 in one day. Yesterday we did over 600, so it's been pretty chaotic. But we tested 83 for HIV in December, and we actually found 3 positives. 1 was an established positive, 2 were new, and we hooked them up with Ryan White the same day. We also gave them 32 COVID vaccines, 18 flu vaccines, 4 Narcan, and I believe we had 8 new people in the month, 1 PrEP, if I'm not mistaken. Rhonda, correct me if I'm wrong. No, not for PrEP. So with the holidays and COVID and everything, that's pretty good. But again, we're trying to balance that. We've had a couple of days we had to pull our strike team in because simply, with patients, some of the staff down with COVID themselves and trying to keep up with demand. But again, we're keeping an eye on things, and as we're able, we want to get out there more. But we still have our teams over on the west side, and we're doing COVID testing and offering assistance.
Great. Thank you so much. Let's see here. Is Christine or someone else from Ryan White or CAMC on? Okay. How about someone from the Covenant House? I saw Cassie.
I'm here. I'm
Oh,
not
there you are.
not on video today. I'm actually at home trying to recover from COVID myself. So it's been an interesting start of the year. So other than that, we put in for another grant to continue to try to get help to get some more feet on the ground, to get the clients that we do have some more support because they're so vulnerable at this point, and it's so cold outside right now. So hopefully as soon as I get better, I'll be back at the warming stations and stuff. Right now, Miss Kay's been at the warming stations. Just haven't got to communicate real well with her to figure out what's all been going on. But hopefully I'll caught up by next week and have better things to report on.
Well, wishing you a speedy recovery and thanks for your update. Other partners with updates for this afternoon?
Are you taking questions, Shannon?
Sure thing.
Okay. Commissioner Carper wanted to know, has the DIS person been hired for Kanawha County yet?
They have not. We are still awaiting the approval and classification of the position from DOP in order to be able to post it.
Thank you.
Mhm.
Others with questions for the group? Okay, well, not hearing any questions, we'll go ahead and dismiss early for today. I know folks are dealing with a lot on their plates early in 2022. Thank you all for meeting with us. We will be meeting in February and we'll be sending out the invite. Stay safe, everyone. Talk to you later.